everyone. As I said in a couple of my posts is that I'm going to start going live every day. The reason is because I do feel as though being on video and making sure I'm informing all of my potential clients or I think it's really important. Live has been something that, I have struggled with a little bit. Here I am, and so every day is going to be a new topic. So today, the topic is healthcare and medical billing. So what does that mean? So let's go through this. When you go to the office of your medical provider, what they do is they ask you for certain information. So normally your name, date of birth, insurance, or whatever, and then the reason why you are going there. It is very important that all that stuff is reported accurately in something called an electronic health record. I say that because I have built 40 privates, and what has happened a lot of times, especially for revenue cycle management, that is not always captured appropriately. When that's not captured appropriately, there's so many different things that can happen. So the patient or the client, right, could get a bill that is astronomical because they did not get billed appropriately or didn't go to the correct ones. If it's a child and you just had a child, it's a newborn, and you're going to, pediatric or what, you have to make sure that at least if the child's about 5 days old or whatever, make sure that you're calling either your employer and also the insurance company so that they're added within the matter of the 30 days once they go to their actual pediatrician. I say all of this because one, why healthcare is so expensive. This is just one reason. Is because a lot of times private practices are billing incorrectly. And when you bill incorrectly, practice, not only does that mean that the patient suffers, right? Because it might be an extra amount on the back end. They might get a $2,000 bill when that's not what should have happened. And then guess what? That patient's not coming back to you. So you have to make sure that your billing is superb. Let's go even further. As a private practice, none of the people that work with you should be separate. In healthcare, we all need to dividing people into sections. And there should not be a front office. There should be a back office. There should not be a business office. All of them should be one. The reason why I say this is because once a medical biller gets the information that they supposedly need, let's say that my name is Courtney Herring, right? So they spell my name Cortney. Well, that's incorrect. So that could mean that if it's sent to Blue Shield, that they deny the claim because they are unable to really confirm, right? But who is really to blame for all of that? Who's to blame is not just that they're billing it out, it's really the whole workflow of your private practice. And with this, in the front office, which is what we call admission, or the person at the front desk, please make sure that there's a copy of the front and the back. The other thing is sometimes people have 2 insurances. Some people have 3 insurances. It is your job to ask those questions. In the front office, administrator or an admin, it's also the responsibility to go ahead and search insurance in many different. I don't believe in eligibility checks within an EHR. A lot of times when you're checking eligibility in an EHR, it's showing you that they have insurance, but it's not showing you what do they need to pay. That is, what is really important. Right now, in healthcare, we have over, some people have like $10,000 deductible, right? What does that mean? What that means, if you have a deductible like that, it could mean when you go to the doctor, you're billed for 100%. Once you spend $10,000 at the doctor's office, then your company will start to pitch in. Now, as a patient, you need to make sure that also watching all of that information. I'll give you an example. Let's say that I am going in, it might be, an OBG appointment or whatever. We're going to make this up just so the numbers are easy. Both of us are for $5,000 and I pay $5,000 cash. I've come twice, right? And second visit, they do not bill it to my insurance, which means that I did not meet my deductible, which means that it's still showing that I have to go out of pocket. That is a problem. So as a patient, one thing that is very important to understand, what does your insurance mean? When can you use your insurance? And when is your insurance activated, right? There's different things. Some insurances have percentages that they're covering. Insurances do not cover substance abuse. There's a lot of things that you have to take in consideration when you're actually purchasing insurance. Every Friday, I'll be talking about healthcare and billing. And healthcare and billing, to me, also includes insurance. Insurance is very important, whether you have it, right? So if you don't have it, we all know that you'll probably have to pay out of pocket. If you are using Medicaid, Medicare, yes, you also have to all of that as well. As a patient, you have to make sure that you're the office, all of the information that you have. Now, let's say that a patient comes in and they have insurance. That means 3 insurances. Let's say that they have Blue Cross and Blue Shield PPO. This is for 65. This is from their something from their retirement, okay? And then they have Medicare, right? And then they also have Medicaid, right? Remember, Medicaid is for aid. Medicare is caring, right? And what that means is there's different things, right? So Medicaid needs somebody for usually actual issues. Medicare is for the care of somebody who cannot possibly care for themselves, and people over the age of 65. So if there's 3 insurances, but the person that only gives 2, but the office only for 2 and doesn't check to see if there's other insurances, then that means that your bill is going to be completely denied. Again, whose issue is that in a private practice? To me, it's everyone's. And the reason is because there should be certain checks and balances to make sure that all of these things are happening. So number 1, patients should always be treated with kindness, respect, and also they should always feel welcome. Number 2, they will give you what they think that they have, but continue to check. Go to Availity, go to different places to see if they have other insurance, right? People are divorced. Sometimes children have like 2 and 3 insurance. Mom has them on their insurance, the dad has them on insurance, and there's a way where that gets all messier. But the biggest thing that I always say with healthcare and medical billing is this: there is no doubt. Stop looking at medical billing as a department. It starts when the patient door. The bill when the patient walks through the door. And I'll repeat that. Bill starts. Patient walks through the door. And when I say that, these are the things happening, right? So Courtney Herring, I actually have 2 insurances. I give one. Then I go and I see the doctor, right? And the doctor says, oh yeah, you have whatever, a knee sprain. And then the doctor writes it down. I have a knee sprain. Then he'll check. Sometimes they still little pieces of paper and they check it, and then you go to the discharge place, right? Now we have to talk about the medical provider, like the actual doctor. Doctor, physicians, and nurse practitioners, and anyone that bills, it is their responsibility to also understand what codes should be. Through your note taking and your notation, that is how coders, medical coders, are able to understand what did in the room, what happened, what was the length, and then what was the city, so that we are able to go ahead and put in a actual code. When we talk about different coding, and it'll, interesting from here, you have to think, you go see a doctor, things are done electronically. Just because my right leg was sprained, there's actually a code for that. So that when the medical bill goes to Blue Cross and Blue Shield, the code means right leg sprain, then there's a price that goes through everything, right? But remember, they forgot that I had a second insurance. When that happens, there's all types of things that occur, okay? Medical billing is collective. It's for the whole office to be involved. When you don't involve your providers, when you don't involve your front office staff, your back office staff, there becomes a huge rift in the system. That rift in the system also causes patients to not want to come to your private practice anymore, because you are giving them bills that they don't feel as though they deserve, or you also don't have anyone to either, one, take responsibility to why is the bill this way, and then number 2, do you have somebody to it, and then number 3, did you really look to see if I have secondary insurance? So I know that was a lot in this first segment, and next Friday, what I'll do is I will break down some medical coding that is really important that physicians should actually know. Not only should physicians or medical providers, you need to know this, I think, as a patient as well. Look at explanation of benefits. You know how these things come in and it's like, oh, it's not a bill. You need to look at that. There's a date of service that's on there, correct, and you never went to the doctor at that time, and you need to make sure that you let people know about that. The other thing is remember the example that I gave. I had $5,000 for the first appointment, $5,000 for the second, and they did not report that. That is another issue that needs to be called out to the practice so that they report it. So it's all of us. But the reason for healthcare and why it is so expensive, just one reason, is due to all of the mistakes that are happening from patient to the actual provider, and then actually even to the insurance company. I just want to continue to enlighten people on what does, your insurance mean. I'll even go ahead and down what does it mean when you have a copay, when it is a percentage. What should office really be doing and making sure that they're doing? It takes all of us to get these bills correct. Because it's a waste of time to send bills to the insurance company that are completely wrong. It hurts the workflow, the practice. It hurts revenue practice, and this is one why medical doctors and healthcare professionals take insurance. But I will tell you why. A lot of times it is their fault as well. It's a work issue. So I am here to all of that to you. So next Friday, I will probably have one of my bidders here, and we'll ask her a couple questions. So if you would questions to be, answered for Friday for healthcare and billing, please let me know. Put it down in the comments, and I think it'll be a great conversation. But I will be late, and I just want everyone to learn. So it's time for me to pick up my kiddo. So everyone have a good day, and I'll see you next time. Bye.